Hi. In this video, we're going to be covering different biological markers that you should look out for in treatment. In terms of assessing the anxiety level that your client's holding when he comes into session and during a session, because based on a person's physiology, your task as a therapist becomes quite different. When a client's coming in with a low level of anxiety and openness, and their state of mind is more open, is going to be a lot different work than when a client becomes emotionally dysregulated or is disassociating. So being able to watch for these biological markers is essential for treatment. And again, is instead of looking at as those sort of responses as problems or roadblocks in therapy, is rather more useful to look at them as a type of instruction for yourself. Road signs that you can look out for to be able to navigate the road of therapy. So the first group is going to be clients coming in that have a high tolerance for anxiety. And these are going to be your most emotionally regulated clients. So they're coming in, they're going to be able to describe their problems in life with with noticeable anxiety, but it's going to be rather light. These sort of people they're going to be fidgeting, they're going to be sighing, there's going to be some tension, and maybe they'll be shifting positions in the chair, licking their lips. Those sort of markers are going to tell you that this person, yes, is anxious, but they're able to stay in that state for quite a long time. The way they'll be describing their problems is going to be more intellectualized. They're going to be able to play with their ideas a lot more, and it won't take so much work to get them from their thinking intellectualization into their feelings, to start accessing those, to get past the anxiety they're feeling, to get to the underlying feelings that are important to explore: anger, sadness, happiness, disgust. The basic emotional responses people have. That anxiety is really a defense in many ways from. So with this sort of client, it's going to be very easy to directly ask, hey, what you're describing there, could we poke around a little bit more? Oh, that was really interesting what you said. Can we explore that more? What you can directly ask, wow, I see there's a lot of feeling there. What would you say the underlying feelings are? Where do you go with those thoughts and feelings you're having? And pushing them in a forward direction. So with this sort of client, again, it's really push, push, push. You're going forward. There's a clear road. And again, looking at it less like there's a roadblock if they're not having this feeling, but more looking at things like, no, this is a green light, go forward. The next set of clients you're going to be dealing with are people coming in at the anxiety level. The first group's peak is, and that's one way of putting it. Where that first group, you see in their muscle tension that they're tight, that there's an edge to them, but they're able to maintain it. Well, this group, they've reached that point when they're coming in, they're going farther with the anxiety. So what you'll see is people transitioning from they're coming in immediately, they're having dry mouth. They have that muscle tension. Breathing rates are much higher. If you were to strap on a pulse oximeter, their heart rate is a lot faster. So anxiety is past where the first group is going, and where it's leading is towards shutdown. Muscle wise, their tension is going to transition into their muscles are going to mush. They're going to start having migraines and headaches. There is going to be nausea. They're reaching a point where they're not able to hold the anxiety, but that the anxiety is really going to start tearing them up inside. But you still have some maneuverability in the work you're doing with these sorts of people. So when you start seeing your client having these symptoms, you're going to start seeing that the quality of their descriptions are going to be a lot different. Instead of intellectualizing their feelings, they're going to start shifting towards more blame, more externalizing the problems of their life as opposed to focusing on themselves. It's going to be, well, that's the other person, that's their fault. Again, a lot more judgment, a lot more blame. So what you're going to want to do is you're going to shift gears. The street light is no longer green, you have a yellow. You want to start bringing focus to the person's anxiety. Start pointing out, notice these symptoms in your body. Check in, see how you feel. We're going towards emotion regulation skills at this point. It would be worthwhile to throw in some psychoeducation. Talk to them about the triangle of conflict that they're currently in. This relationship between feelings, anxiety being one way of people dealing with the feelings they need to deal with, and then, when anxiety becomes too overwhelming, people shift into defenses, blame, judgmental stances. And that's going to take a couple times for them to start getting a sense of recognizing their internal feelings, their bodily sensations, and the quality of how they're describing the problems in their life. But stick with it. Do you notice you seeing that your body's doing ... Point out the symptoms, and you're going to find that your client's going to be more emotionally regulated, and you might even want to try using some different mindfulness skills at this state to first notice what's going on, but then to shift gears and to be able to calm oneself. Maybe get into paced breathing. Maybe paired muscle relaxation is another technique you can use. But you're going to want to, again, get the person emotionally regulated, reduce the level of anxiety to something that's more useful, like the first group of clients that I described earlier. And so you can shift back into the work and get that green light. The third group of clients are people who are coming in and they are 100% emotionally dysregulated. There is not this tension in the muscles anymore. They're way past the physical symptoms of stomach aches, nausea. They're the clients that are coming in, they're jello. They're just slumped in the chair. You're trying to figure out how exactly are they not falling to the floor. There's no sign of clenched teeth. There's no sighs into the questions that you're asking. There's a certain level of despondency. Now, this can be a little tricky because these clients are going to seem as though they're just fine. It might even be, they definitely seem off. You as a clinician are thinking, something's wrong here. But it's almost as though they're responding the same way that, say, as a clinician, you're a normal human being. You have conversations with friends and loved ones. It's almost like, are we talking about the grocery list? It'll have that quality of being too rigid. The person's too in control. And it's because they're really grasping at straws here. They're trying to maintain their level of control because they're about ready to lose it. So it's going to be that absence of anxiety is going to be your tip-off, and that rigidness, that sort of on edge, on top of they seem to just be melting in the chair. That should be getting your attention, that this is a red light, that you need to stop wherever you're going and address this one quickly. Now, the way these clients are going to be describing their life problems is going to be thick with judgment, thick with criticism, and you are going to be getting most of the blame. Questions like, where is this therapy going? Do you even know what you're doing? This is a waste of time. Why am I even here? Are you trying to find out something? It's going to be attack after attack after attack towards you, the therapist. What you're going to want to do in this sort of situation is a lot more than just emotional regulation. Your starting point is going to be using validation skills on your end to try and re-regulate as best you can your client, to address this alliance break that you're currently suffering from. And really, it's not going to be necessarily through any fault of your own. Life happens, and clients are coming in because there are problems. So you're going to want to be ready to jump back and reorient yourself towards, we're not solving the problems that are outside the room. Right now, we're going to want to get back to baseline levels of anxiety. That would make sense with the problems you're having. Focus on the relationship between you and the client. And again, the best way to do that is to use the 6 levels of validation. And I have a video on that, and it's worthwhile checking that out to have those on your fingertips so that you can navigate these situations effectively. Once validation has been used, then you're going to want to slip into more of the mindfulness skills, the emotion regulation skills, paced breathing, all that fun stuff. And then when you have the person more regulated in their anxiety, where you have normal levels of tension that they can manage, well, you've successfully waited at that red light long enough. It's going to eventually turn green, and you can proceed ahead with the work you need to do to bring the person into more of an awareness of their feelings, to be able to cash in on those feelings and get the wisdom they need out of it to be able to make sense of their life more clearly and accurately. If you found this video useful, you can go ahead and give it a like and share it with your friends. If you want to send me a message, you can do so in the comment box or check out my website and shoot me an email. And go ahead and check out my Patreon account to help support me in the work I'm doing here. I'll see you in the next video.